हेलो फ्रेंड्स। तो आज हम लोग डिस्कस करने वाले हैं एक बहुत ही इम्पॉर्टेंट इलेक्ट्रोलाइट को लेकर, एंड दैट इज़ पोटेशियम। ठीक है। सो पोटेशियम जो है वन ऑफ द मोस्ट इम्पॉर्टेंट इलेक्ट्रोलाइट्स है, एंड उसके काफ़ी इम्पॉर्टेंट फंक्शंस रहते हैं हमारे बॉडी में। ओके। सो फर्स्ट ऑफ ऑल हमको जानना पड़ेगा कि व्हाट इज़ द नॉर्मल amount or the level of potassium which is supposed to be there in the serum. Okay, so what is that? So normal जो पोटेशियम लेवल रहता है सीरम में वो है 3.5 से 5 मिली इक्विवेलेंट पर लीटर या मिलीमोल पर लीटर। ओके, सो ये जो है ये है नॉर्मल रेंज। अगर इससे डेविएट होता है देन इट कॉजेस इलेक्ट्रोलाइट इम्बैलेंसेस, राइट। तो अगर इससे कम होगा तो उसे हम कहेंगे हाइपो, अगर उससे ज़्यादा होगा तो हम उसे कहेंगे हाइपर, राइट। तो पोटेशियम के लिए जो नाम है वो है कैलेमिया। ओके, लाइक कैल। सो फिर अगर इसमें आपका जो पोटेशियम लेवल है सीरम में अगर वो 5 मिली इक्विवेलेंट पर लीटर से ज़्यादा हो जाएगा तो उसे हम कहेंगे हाइपर कैलेमिया। ओके। So what is hyperkalemia? Hyperkalemia is an increase in the serum potassium level than the normal window, that is more than 5 milliequivalent per liter. Then we call it hyperkalemia. ठीक है। अब क्या है इसका क्या क्या causes हो सकता है? What could be the causes of hyperkalemia? First, there is an increased potassium intake in the body either by parenteral administrations or potassium drugs or potassium containing salt substitutes. ठीक है। So basically if there is an intake of potassium that can cause a situation of hyperkalemia. Apart from that और क्या हो सकता है cause? There could be a shift of potassium out of the cells. जो इनसाइड सेल्स में सेल के अंदर जो पोटेशियम आयन्स है दे कैन गो आउट ऑफ द सेल्स। दैट कुड बी अ सिचुएशन ऑफ एसिडोसिस। सो एसिडोसिस होने पर क्या होता है? इट लीड्स टू हाइपरकैलेमिया। ओके। इफ देर इज टिश्यू कैटाबॉलिज्म या फिर देर इज़ अ क्रश इंजरी देन ऑल्सो देर इज़ अ शिफ्ट ऑफ पोटेशियम आउट ऑफ द सेल्स विच कॉजेज हाइपरकैलेमिया। अदर देन दैट क्या हो सकता है? देर कुड बी फेलियर टू एलिमिनेट द पोटेशियम। कब? when there is a failure to eliminate potassium, when the elimination system is being wronged. For example, there could be a renal disease, there could be potassium sparing diuretics being used or NSAIDs being used or ACE inhibitors being used. So इस केस में क्या होगा? There is a failure to eliminate potassium from the body and as a result potassium जो level है in the serum will increase. Okay. इसके अलावा देर इज़ वन मोर इम्पॉर्टेंट कॉज जिसे हम लोग कह सकते हैं एड्रिनल इनसफिशिएंसी। एड्रिनल ग्लैंड्स का क्या काम होता है? टू रिलीज स्टेरॉइड्स। व्हेन देर इज़ अ डेफिशिएंसी ऑफ दीज कॉर्टिसोल then it's called Addison's disease. ये Addison's disease also leads to an increase in the serum potassium level which is hyperkalemia. Okay, now coming to the clinical manifestations. राइट। सो क्लिनिकल मैनिफेस्टेशन में क्या होगा? बिकॉज देर इज एन इलेक्ट्रोलाइट इम्बैलेंस, एन इलेक्ट्रोलाइट विच इज़ वेरी क्रूशल टू द फंक्शनिंग ऑफ द कार्डियक सिस्टम एज वेल एज द मसल्स। सो उधर क्या होगा? देर विल बी इरिटेबिलिटी इन द पेशेंट, राइट। देर विल बी एंगजाइटी, देर विल पैरास्थेशिया. पैरास्थेसिस मीन्स देर इज अ weakness in the muscles, right? Not totally paralysis, but there is weakness which can cause paralysis, right? Then there is irregular pulse, there could be cardiac arrest, muscle weakening is there could be cramp, and there could be diarrhea also. Means for clients who are having hyperkalemia, we have to maintain extra precaution to prevent cardiac arrest because there is an imbalance of potassium. Such clients are at a risk of dysrhythmias, right? They could be leading to life-threatening condition such as a cardiac arrest. Now for such clients, what will the ECG show? Very important, what will be the features of ECG? So for hyperkalemia, the ECG will have a tall peaked T. The T is taller than the normal. Okay, there is an ST depression will be there, and a wide QRS complex will be there, right? There's prolonged PR interval, a wide P wave, and a decreased R wave will be there. Okay, so let us differentiate it from the normal ECG. When there is normal potassium level, that is normokalemia. Over here we can see that this is a normal T, the R is normal. Okay, this is a normal wave. But when there is hyperkalemia, we can see that this T has made a peak, a tall peak, while the R, which is supposed to be higher in amplitude, has reduced in its height. There is a widening of the QRS complex as compared to this, and there's an ST depression over here in case of hyperkalemia. Okay, so this is the important difference of ECG complex in case of the patient with hyperkalemia. ओके सो अब हम बढ़ते हैं इंटरवेंशंस की तरफ. ओके, सो व्हाट कुड बी द इंटरवेंशंस व्हेन द पेशेंट इज हैविंग hyperkalemia? First, we have to discontinue the potassium, right? So obviously अगर पोटेशियम ज़्यादा है तो हमें जो है पोटेशियम को डिसकंटिन्यू करना है. Second, there we will be restricting the potassium in the diet, right? So potassium restricted diet has to be followed. Third, sodium polystyrene sulfonate is to be administered either orally or through rectal route. Why? Because this particular agent acts as a cation exchange. So how it does a cation exchange? Cation means two positive electrolytes, right? Two positive charges will be exchanged. So what is to be exchanged here? For potassium, the exchange is with sodium. So what will happen? It provides the sodium absorption in the GI tract, and in exchange the potassium will be excreted. So we are using sodium polystyrene sulfonate so that the sodium will be absorbed and potassium will be excreted, which is not needed in the body because its level is much higher than required. Okay, now in case the patient is having severe hyperkalemia, so हम तब क्या करेंगे? We will give IV calcium. Okay, we will give IV calcium for what? To prevent the myocardial excitability. Okay, next is we will give IV hypertonic glucose with regular insulin. What will it do? It will move the excess potassium into the cells, right? So IV calcium to prevent the myocardial excitability, and hypertonic glucose with regular insulin so that the extra potassium moves back into the cell, right? Next is, if the patient is prescribed for blood transfusion, okay, for blood transfusion we will have to ensure that the patient receives fresh blood only. We cannot take chance of giving the patient a not so fresh blood or the blood which has been procured much earlier. Why? Because the longer we keep the blood packet, more and more blood cells will be broken down and more potassium will be released, and if we transfuse that blood, it will again create hyperkalemia in that patient. Got it? From this concept only, there is a term which is called pseudo hyperkalemia. What is pseudo hyperkalemia? Suppose we are withdrawing blood from a patient to test its electrolyte levels, okay, and in case in that blood specimen a lot of blood cells have had to face lysis, so there will be an increased value of potassium in that particular blood sample, but actually the patient is not having any clinical symptoms. So in that case it is called pseudo hyperkalemia. Okay, now next is that we have to monitor the potassium level in the client who is having being administered potassium sparing diuretics. Okay, so potassium sparing diuretics are those which will help to retain the potassium in the body while removing the extra fluid, extra water. So in that case also the patient is at a risk of developing hyperkalemia, so we have to monitor that kind of patient very closely. So friends, that was the class about the hyperkalemia. So a quick revision: what is hyperkalemia? Whenever the serum potassium level is more than 5 milliequivalent per liter, that is hyperkalemia. It could be due to various causes like an increased ingestion or intake of potassium into the body. There could be shift of potassium out of the cells. Why? Because of acidosis, or there could be a tissue injury or the destruction of cells. It could be due to Addison's disease, due to the adrenal insufficiency. It could be due to usage of potassium sparing diuretics, or it could be due to the kidney failure also. And there's a varied range of clinical manifestations which could be seen in different systems, but here of most concern is of the cardiac system, because potassium plays a very important role in the proper functioning of the cardiac system. So whenever there is a hyperkalemia, there's a increased chance that the patient will suffer from dysrhythmias, and ultimately there could be a life threatening situation of myocardial infarction, or there could be cardiac arrest. Okay, now one of the important features over here in hyperkalemia is the reading of ECG. The key feature over in this case will be a tall T wave and a shorter R wave, and there will be ST depression seen in case of hyperkalemia. Okay. Now, interventions could be very critical over here and very helpful for the patient. The one of the most important interventions is that we can do a cation exchange with the help of sodium polystyrene sulfonate, so that the potassium is excreted and in return sodium is being absorbed in the GI tract. We can use IV calcium in case there is a severe hyperkalemia, in order to prevent the unwanted cardiac excitability. Okay, and also we can use hypertonic glucose with regular insulin, so as to move the extra potassiums into the cells, inside the cell. Okay, we have to be very careful that we administer only fresh blood, and a close monitoring of potassium is required if the patient is on potassium sparing diuretics. So friends, this is all for this video. If you like this video, then please give a like on this video by pressing the like button, and you can subscribe the channel if you want more such videos, and if you have any query you can leave a comment. So bye and stay tuned.